Bismillahirrahmanirrahim. Assalamu alaikum. Welcome to the presentation on asthma management in dental setting. Understanding and managing this situation is crucial for patient safety. Asthma can be triggered by stress or certain medications. Asthma symptoms include shortness of breath and wheezing. Patients may show rapid breathing and heart rate. Severe cases may lead to hypoxia, cyanosis, and unconsciousness. This box shows the manifestation of an acute asthmatic attack can be mild to moderate or it can be severe. If asthmatic attack occurs during dental treatment, then terminate all treatment immediately. Position the patient upright or nearly upright. A patient should use bronchodilators, which may contain epinephrine. Administer doses cautiously to prevent overdosing. Provide oxygen to the patient. Continuously monitor the patient's vital signs. If the signs and symptoms are relieved, monitor the patient during a recovery in the office. Discontinue any IV lines. Provide no further dental treatment until the patient's physician approves. If signs and symptoms continue, then administer oxygen through nasal prongs or a face mask, especially if high flow oxygen is required. In severe episodes or in ineffective aerosol therapy, or if the signs and symptoms continue, inject 0.3 ml of 1:1000 epinephrine intramuscularly or subcutaneously. Start an IV line and drip of crystallite solution at 30 ml per hour. Monitor vital signs. Call for emergency medical help in severe respiratory distress. If signs and symptoms are still not relieved, call for medical assistance. Start to 50 milligram of theophylline IV given over 10 minutes. Administer 100 milligram of cortisone or equivalent IV. Prepare for transport to an emergency care facility. Students are advised to take screenshots of slides 10 to 14 for their reference. Welcome back. Hope you found taking the screenshots helpful and enjoyable. Now let's continue with the rest of the presentation. Respiratory problems from drug allergies can mimic asthma. Management involves similar steps, emphasizing the importance of correct identification and treatment. To sum up challenges in the asthma management, emotional stress or certain drugs can trigger asthma in susceptible patients. Regarding symptoms, patients often know the onset symptoms of bronchospasm, such as shortness of breath and preferences to sit upright. Furthermore, audible wheezing abnormality, rapid breathing, tachycardia, and use of accessory muscles are common. In severe cases, hypoxia, cyanosis, and loss of consciousness may occur. Management. Start by placing the patient in an upright position. Allow them to self-administer bronchodilators such as those containing epinephrine or albuterol. Administer oxygen if needed, and in severe cases, inject epinephrine 0.3 ml of 1:1000 dilution. Outside emergency, medical assistance may be required for severe respiratory distress. Regarding drug allergy, respiratory issue from drug allergies can mimic asthma, but the management approach remains the same. Thank you. Wish you best of luck.